Ink. So, all right. Firstly, I would like to start this evening by acknowledging the traditional owners of the land on which the work of ours at the Northwest Melbourne PHN takes place. So our traditional custodians are the Wurundjeri Woiwurrung people, the Bunurong people, and the Wathaurong people of the Kulin Nations. I'd like to extend my respects to their elders past, present, and emerging, as well as a warm welcome to any Aboriginal or Torres Strait Islanders with us today. So, a little bit of housekeeping before we get started. Now, we're going to try something different. I'm going to see if you can navigate things. What I would like you to do is see if you can find your toolbar in Zoom. In that toolbar, you're going to find two really helpful boxes. So one is the Q&A box. So if you have some questions that you'd like to ask as we go through the webinar this evening, please use the Q&A box to pop them through. What I'm going to get you to do, putting in the chat box, which is sitting right next to the Q&A box, in 2 words, what concerns you or what confuses you the most about cold chain. So if you want to pop your responses in there, and I'll make sure that we get around to covering those off this evening if it's not covered in the content. So to get going, if you can please just make sure that the name that you've joined the webinar this evening is the name that which you registered for the webinar, just so that we can mark your attendance and issue certificates out in your name. If you're not sure if your name matches, you can just pop a little note in the chat box or the Q&A and we can help you out. So before we get into the content, if there's anything that you walk away from this webinar that you are a little bit confused by or you wanted a little bit more information on, our health pathways are always available for those in the Eastern Melbourne PHN and Northwest Melbourne PHN regions. So it's clinical guides. There is a whole section in there on vaccine cold chain, how to manage a cold chain breach and immunisation. It is a single log on now, so if you haven't already created an account, then you certainly can. There's a QR code there. You can also jump onto the website or email the Health Pathways team and we can help you get started. So I would love to introduce our speaker this evening. Deborah Kurtz is the most incredible registered nurse and diabetic educator. So she joins us tonight as part of her role as at APNA. So she's currently a nurse education officer but has a heap of experience in diabetes education and also has a Cert 4 in training and assessment. So we are extremely lucky to have Deb with us this evening to teach us all about cold chain. Over to you, Deb.
Thank you, Natalie. Thank you very much. It's a pleasure to be with you this evening. And I'm joining you from the lands of the Coombe people, the saltwater people of the Gold Coast. They belong to the 9 clans that belong to the Yugambeh Nation on the Gold Coast or Southeast Queensland. So thank you for inviting me along. And I am trying
Sorry, I will stop sharing.
To share my screen there. It wasn't coming up. That should be now. Alrighty. So, as Natalie said, we're going to have a look through and walk through cold chain management this evening. Normally, I'd be joined by Sarah Drew, who is the manager for courses and workshops here at APNA. But unfortunately, she wasn't able to join us this evening. So you've got me instead. So I've had quite a number of years working in general practice and have working knowledge of this particular topic as well. So hope to be able to share some knowledge with you this evening or even just as a refresh. So part of what we're going to look at tonight as one of the objectives for the learning is that hopefully you'll walk away with some enhanced knowledge, skills, regarding best practice for cold chain management and to ensure safe and effective vaccine storage and handling in accordance with Strive for 5 guidelines. So by the end of tonight, you should be able to describe the principles of cold chain management, and that includes the required temperature range and the importance of maintaining vaccine potency throughout the storage and transport process. Also, identify and implement procedures to prevent and respond to cold chain breaches, including monitoring of equipment, our documentation requirements, the reporting requirements to Vic Department of Health. And finally, apply the National Vaccine Storage Guidelines or Strive for 5 in your daily practice. So we're looking at the equipment again, our vaccine purpose-built fridges, temperature monitoring, staff training and compliance and continuity of care. Just before we move on, I'm going to ask you a question, so just to test your knowledge. So this little question comes up. So in accordance with the National Vaccine Storage Guidelines, STRIFA 5, how long can vaccines be exposed for above 12 degrees without being considered a cold chain breach? If you want to pop your answers in the chat, you've got 4 different options there. I'll just give you a few seconds to look at that. Awesome, 15 minutes I've got there. Any other? 5, 1, 5, 15, 15. Oh, we've got some very, very knowledgeable people here this evening. So awesome. Excellent. Yes. Oops. So the answer is definitely 15 minutes. So cold chain breaches are managed, as we've already mentioned, under the National Vaccine Storage Guidelines, which aims to ensure that vaccines are stored between that 2 and 8 degrees Celsius, with 5 being the optimal midpoint. And there can be temporary deviations up to 12 degrees Celsius for 15 minutes or less, and they're not considered to be breaches under STRIFA 5. So that is correct. So awesome. So a lot of you have knowledge of the National Vaccine Guideline Storage Guidelines. This is just a little slide that contains the topics or the points that are covered within the guidelines, and I'm going to be referring it to STRIFA 5 throughout the rest of the presentation rather than its full name. So we'll be looking at basically all of these points throughout the evening. So firstly, what is a cold chain breach? Oh, sorry, what is cold chain? We might start there. So according to STRIFA 5, the cold chain is a system of transporting and storing vaccines within the safe temperature range of +2 degrees Celsius to +8 degrees Celsius. The cold chain begins from the time the vaccine is manufactured and continues throughout the process that includes delivery to state distribution centres, immunisation services, and ends when the vaccine is actually administered. So there are quite a few steps or links within that chain where there could be issues. And as I've got noted there, really the cold chain is only as strong as its weakest link. So we're monitoring the cold chain, as we've said, from manufacturing right through to transportation, whether that be air or road transportation, to the storage facility, then the primary vaccine storage facility, which is the state storage. Again, transportation on the roads to pharmacies and other immunisation providers such as general practices and community-based services. Then the actual storage within the fridge within that organisation. And then as we prepare the vaccines for our patients or clients, and then finally with that administration to the patient. So lots of links there that could fracture. And so why is it important? There's a few different elements that we need to consider. Firstly, as health professionals, we have a responsibility to ensure that our patients, clients receive effective health products, and that includes vaccines, that have not been adversely affected by heat or cold. We also know that vaccines are expensive and often can be in short supply, so that financial value that's contained within our refrigerators can be quite substantial. And the other is to reduce the risk and liability. So good vaccine management precludes the need to revaccinate any patients who may, under other circumstances of poor vaccine management, have to receive or have received ineffective vaccine, need to be revaccinated. And cold chain breaches can occur as a result of technical malfunction. So making sure that the equipment that we're using and the systems that we are managing, have in place to manage our cold chain, are well designed, and that there are effective procedures in place so that we can identify or detect problems either before they become ineffective vaccines, or stop that from happening. And also, effective or efficient vaccine storage management is good quality, or providing good quality assurance measure for the immunisation provider. So making sure that you're standing within the community as well, that you're providing safe and effective vaccines continues, and you will have people coming back to you because you're able to provide a very good service to your patients and your communities, and we can increase the number or the vaccine or vaccination within our communities. And to ensure that as well, that their heat and the freezing temperatures that has a cumulative effect on the vaccine viability doesn't impact that efficacy of the vaccine. So there's quite a few things there that we need to consider and why cold chain is important. Now we'll have a look at what a cold chain breach is. So according to Striver 5, you can see there the definition that a cold chain breach occurs when vaccine storage temperatures deviate from or outside of the recommended temperature range, which is that +2 to +8 degrees Celsius, and we're not meeting that optimal 5 degrees Celsius. Also, vaccines we know can be they're quite delicate, so they can become less effective, or their potency can be quite diminished or destroyed if they become frozen, or if they're exposed to direct sunlight or UV light, including the fluorescent lights, or they're allowed to heat up and get warm. So in the event of any of this, we need to be able to know what to do in the event of a cold chain breach, and that is covered in Appendix 3. There's a good protocol within Striver 5 that you can actually have a look at, and it goes through all of that. So if we don't protect our vaccines, as we've got there, they won't protect our community. And so we know that immunisation, vaccination is a bit of a contentious subject in different areas across our nation and within our states and territories. So being able to provide that safe and effective service by maintaining the cold chain, again, is a positive impact and encourages people to come back to your service for immunisation and protection of those that are unable to be vaccinated. One thing, though, to know is that there can be excursions of above 8 degrees Celsius up to 12 degrees Celsius if, as we said before, for less than 15 minutes, that can occur when we're restocking the fridge, and they're acceptable. So they would not be classed as a cold chain breach. So we've said there's quite a few different things that we need to keep in mind when we're looking at cold chain breach. And there's impacts on the cold chain breach. So we'll have a look at that. One of them we've already discussed, but again, it's that our patients, whether we need to recall them and have to revaccinate them. And if you're doing lots of childhood immunisations, imagine if you're that parent getting that phone call from public health saying, unfortunately, there was a breach in the cold chain process. We have to bring your bub back and revaccinate because of these vaccines are not as effective because they've been exposed to temperature or light or whichever the cold chain breach is. So you can imagine how that will affect the mum, the trust in the vaccines, and then in the service, and often they might not be as interested or keen to have more revaccinations. Another impact is that after the administration of that medication or vaccine, we're giving them something that's ineffective. So again, it's impacting the patient. There's that loss of faith within the organisation, and also with the what we're trying to achieve in prevention of communicable diseases or vaccine preventable diseases. We've got litigation as another issue that can be an impact of cold chain breach. The amount of time that you as the nurse in the service, having to recall and go through patient files to see which patients have been or may have been affected by that breach, and then and discussing that with them so that they're aware. There's also then the potential that there may not be enough supply for you to be able to revaccinate your patients in a timely way. And then we've also got the cost, the significant cost of replacement of our inactivated vaccines. And I'm sure we've all got or had experience where we've had issues with particularly power outages, as they seem to be the biggest issue, whether that's caused by storm or just some electrical malfunction, where we've literally had to get rid of a whole fridge full of expensive vaccine. And it's just heartbreaking to think that can happen. So important that we know what to do, and if we can prevent that from happening by having these procedures and in place in our organisations. So safe vaccine storage management. It's all about making sure that we're following the guidelines from STRIVE for 5, and it's making sure that we're using or storing our vaccines in purpose-built vaccine fridges that have a data logger attached. Always storing our vaccines in their original packaging within the fridge, so that we're not exposing them to temperature changes, and also light for those vaccines that are sensitive to light. Making sure that we have documented practice policies and procedures in place to guide yourselves, to guide other staff, and in the management of vaccine management. It's important also to make sure that you've got a way of storage, temporary storage and monitoring equipment in preparation for events like power outages or vaccine fridge malfunctions, those sorts of things. Or even if you're doing outreach clinics for vaccination, making sure you've got the appropriate equipment that you can actually safely transport your vaccines. Again, we need to make sure that we're monitoring our fridges, the temperature, and we're doing that twice a day during operating hours and recording that on the approved temperature chart. We also need to make sure that we're conducting our annual vaccine self-audits that, again, is contained in STRIVE for 5. And also, most importantly, is that we're not doing anything or discarding anything until we are advised by public health as to what vaccines require discarding or can be the date changed to use sooner. Some of our vaccines we can do that with, which is very good. So again, just making sure that people are aware not to throw out vaccines until you've had direction from public health. And it's unfortunately often falls on just one person within the practice, usually the treatment room nurse or immunisation nurse. But really, cold chain management is everybody's responsibility, whether it's non-clinical staff, our medical colleagues, and any other nursing staff within the practice, making sure that they are aware of the policies and procedures, making sure they're educated about how they manage delivery of vaccines if you're not there to receive those, and what to do in emergencies like power outages or a breach or an alarm going off on the fridge. So it's making sure that everybody is aware what to do in those sorts of instances. So we're going to look at some of the reasoning for having some practice policies and procedures in place, and why it's important to have specifically a nurse immunisation program officer within your organisation. Some of you may be that because you're the only nurse there. But if there's multiple of you, often it's the person who has a real passion for immunisation that will do that. Having that person involved in the policy and procedure development, as well as reviewing of those policies and procedures to make sure that everybody is following the up-to-date guidelines for Strive for 5 and maintaining evidence-based practice in that regard. So there's a few different things that nominated person is involved with, and we've got a few of those here, but also having someone as a backup person, like I said just previously, that person may not be there for whatever reason. They might be on annual leave, they might be on sick leave, they might be at lunch when an order arrives and it's been signed in. We need to know, people need to know what to do when that happens. So making sure that whoever receives the vaccines knows what to do upon a receipt of that, so that they're not sitting at the desk in the box until you get back, which again, there we have a possible cold chain breach. So education of the team is really important in this setting. The nominated person, immunisation program officer, makes sure that everybody is following protocol. So making sure that the temperatures are checked twice a day, that stock maintenance and rotation occurs, that the data from the data logger is reviewed every week, and that can help to identify if there's any issues or potential issues that can be jumped on first, so that it doesn't become a huge problem. If there's occasional increases in temperature that you can see and there's been no activity with the fridge, so you may be able to pinpoint those and have things, a maintenance check or something like that happen. And also who does the reporting to the public health unit when a cold chain breach arrives. So if that person is not there, who then becomes responsible for that, and are they educated and had training in what to do and where to find all the information, as well as making sure that audits are done, those processes are followed, and the maintenance, again, of the equipment is attended to. So a lot around education of the actual team is involved for that nurse immunisation program officer. Needs to be in your position description as well, so that the team are aware of that, and also on your or in your vaccine management policy, making sure that the dedicated or nominated people are listed there as well. So this slide here just talks about, again, a bit more about what's involved by the nurse immunisation program officer. So making sure that the downloading and the storage of the data logger records are maintained. Again, making sure that there's monitoring done of the vaccines when packed in the cooler, so that you might be overseeing that. So again, making sure that staff are aware and trained in how to do that, and and ensuring that competencies around that are maintained every year as well. And maintaining those checklists, so having those at your fingertips or easily accessible. And you can see there's some checklists that are recommended for you to download and have hard copies, so packing and transporting of your vaccines to a clinic or in an emergency situation, and then also that what to do in a power outage. And in Victoria, vaccine fridge temperatures need to be recorded twice a day on each day the practice is open. And ideally, that should be at the beginning and the end of each day. And it's also a requirement for all immunisation providers receiving government-funded vaccines from Vic Health. So again, you wouldn't be able to receive your vaccines if you are not following those recommendations. And they also recommend that the data logger should be downloaded weekly and those records maintained. I've already mentioned about delivery of vaccines. So I have had an experience where, yes, I may have been at lunch and there was a vaccine order, just a small order came through. It was just in a nice little cardboard box, all sealed, all beautiful. It had been received by a reception member, and just left on the desk. And it was a good half hour before I got back from lunch, and unfortunately, I had to report that as a cold chain breach because the temperature tag indicated, or the cold chain indicator indicated, that there had been a breach, and it had reached over 12 degrees for more than 15 minutes. So again, that highlights an area for quality improvement. So making sure that all staff, whether they're new staff or changing roles within the team, that there's education provided to all your staff so they know what to do. So as you see there, that includes checking that the delivery is correct. So sometimes, particularly I know through COVID, we got another medical practices delivery of the COVID vaccines. So therefore we had to quickly get them down to them to make sure that it didn't exceed that 15 minutes. Luckily, they were only 5 minutes down the road. But again, it's those sorts of things, making sure that it's being delivered to the right practice. Checking for the cold chain indicator is within the range that it needs to be. Transferring those vaccines straight to the fridge. And once you've unpacked those, discarding those single-use cold chain indicators. So there's a few more things there that we need to make sure that staff are aware of. So that delivery of government stock contains those single-use indicators, and the person that's responsible for the management of vaccines within the practice should be made aware of delivery. So I was only upstairs in the kitchen. I could have been contacted and said there's a vaccine delivery here, and I could have come down, popped them in the fridge, gone back and finished my lunch, and then sorted it out when I got back. And then that would have mitigated that issue. And also there, we've already mentioned that vaccines must be kept in their original packaging, again, because of temperature control, and we need to rotate our stock regularly so that we're using our more expired stock beforehand. So these are some of the cold chain indicators that you might get in your government-funded vaccines. So you can see there that the picture on the left shows that the temperature range is within the parameters that it should be, with the arrow and the little circle, and it's approved to the tick. And then in the picture on the right, you've got where it has breached or has gone outside those parameters. So therefore, that would need to be followed up with a notification. If there's no tag alert in the delivery, you need to contact OneLink immediately. And if a breach has occurred, isolate these vaccines in the vaccine refrigerator, pop a sign on the box or whatever receptacle it comes in to say do not use or discard vaccines. And then you will be advised once public health have actually gone through the process of reviewing what information you send to them, and then you'll be told what you need to do with those vaccines. So there's a few things that we need to do once we've received our vaccines, and that is particularly within general practice, we should all record the batch numbers of the vaccines in our software. And those records that can include, that we need to keep as well, include our delivery dockets from that, a manual spreadsheet if you've been given that, and then entering those batch numbers into the immunisation screen in the patient's file as well. So there's a few things where we need to add our batch numbers in. We'll talk about the vaccine storage, and as I said before, it is recommended within Striker 5 that we use purpose-built vaccine fridges as they're considered to be best practice and only suitable for vaccine storage. Domestic and bar fridges are no longer acceptable. The vaccine fridges are more reliable and well maintained and they have a reasonable size. So if you're a busy practice and you're doing a lot of vaccinations, making sure that you have adequate storage and not an over filled fridge to maintain the temperature and potency and efficiency of your vaccines is really important. So it may mean having to upgrade and get a bigger fridge or getting another fridge. My practice had two. We had one upstairs, one downstairs, which was very handy during COVID because we had our clinics for COVID upstairs, and all our COVID vaccines were in one fridge, which made it much easier to handle. And all our regular NIP vaccines were downstairs, so it made it so much easier to navigate. As I've already mentioned, the minimum and maximum temperatures of the fridge must be recorded twice daily and reset, the thermometer reset after each reading. And these records must be retained for the same amount of time as medical records. So if you have paper copies, you might want to start scanning into a file that you can store on a thumb drive so that you've got those records rather than keeping lots of paper copies for an extended period of time that will take up a lot of space. Also, the use of the fridge vaccine for medication and vaccine storage only. Shouldn't be used for anything else. No specimen holding or other consumables like food or drinks. That should be housed in a separate fridge. So as I said, our purpose-built fridges are designed specifically to store vaccines and are best practice. And the advantages is that they provide a stable, uniform, controlled cabinet temperature between that 2 to 8 degrees Celsius. They also have a standard alarm and safety features which alert to and or prevent irregular temperature fluctuations in that cabinet. Some have inbuilt monitoring and others have external data loggers. And whichever way you're able to download that data is completely up to you and your organisation. They are so much easier to manage than our domestic refrigerators to store vaccines. Good temperature recovery after the fridge has been opened is better than a domestic fridge, and nearly all the internal space can be used for vaccine storage. So if you're wanting to ask about how you pack your refrigerator to accommodate your maximum quantity of vaccines, talk to the manufacturer or your company that you're purchasing or looking at purchasing your fridge from, and they'll be able to give you the best information with regards to that. So vaccine storage requirements, as I've mentioned, we don't want to overstock the fridge, as again, that can cause issues with temperature control and also airflow, which impacts the temperature as well. Ideally, you should be only using approved baskets to configure or store your vaccines in. You can see there it needs to have some gaps around the walls so that the air can flow. And we need to make sure that our temperature remains within that range of +2 to +8 degrees Celsius, again, by regular monitoring. The data logger positioned in the middle of the refrigerator to ensure that we're not going to have any issues with hot or cold spots. Like I mentioned, the baskets to use to facilitate that airflow. We shouldn't be storing any stock on the bottom shelf, again, with condensation building up around the sides and the bottoms. We don't want damage to any of the packaging. And we need to make sure that the fridge is in a secure area away from light or direct sunlight and heat. So making sure that, and again, if you're using or in a air-conditioned area that has fluctuating temperatures, may need to check that it's not going to get too hot once you've had the air conditioning turned off for an extended period of time. So once the practice closes overnight or even over weekends, making sure that there's a consistent temperature and it's not going to overheat. And we need to, again, consider the power source to make sure that that's reliable. So having a specific power outlet that should be earthed, and a sign there to say, do not remove, do not unplug, this is a vaccine fridge. Also having that other sign there to say, stop, don't open the door until you know which vaccines you need. Natalie had a very interesting Steve Carell meme that would be very good to put on a fridge as well. So you might share that later. And also, again, we're talking about vaccine storage, so making sure that we're using the earliest expiry vaccines and putting them to the front. And also an idea would be to consider using a vaccine map. I don't know how many of you have seen them. You might already have one in your practice already, but this one here, you can actually download and adjust, like edit to your own way that you stock your fridge, and you can put in there so that people can see, well, on the top shelf, these are the vaccines for our 0 to 6 months and continue. So that's probably something worthwhile to put on your fridge. And this, just noting there that it still says Prevnar 13. This hasn't been updated since the introduction of Prevnar 20. So I apologise there, but again, you can customise that to using that link there, and it is also in your resource package that you'll get access to after the presentation as well. And you can make that usable in your practice. So with recording of our temperatures, so there are digital thermometers. These are external digital thermometers that you can use, that we need to have available for when we're packing our coolers, if we're doing off-site clinics, or in the event that we have a power outage and we need to store our stock in coolers. And also to ensure that the temperature that is being read by our inbuilt thermometers is correct. So there's a little picture of those up there. Again, it's a twice daily check, resetting that min-max thermometer after each reading. We record any events such as deliveries or temperatures, temperature monitor on our temperature monitoring chart, so we know when there's an elevation, and and monitor that so that it comes back within that normal range. Again, following our cold chain breach protocol if the temperatures are outside that parameter. So that little picture is that portable digital thermometer. And again, it doesn't have it's digital, so you'll need to have batteries to be able to change that. But making sure that that's changed either every 6 to 12 months, and particularly in case of any breaches, so that it's there ready to go. You've got it sitting in the fridge, and you can just pop that back into your cooler when you're packing that for whatever reason you're needing to do that. And you place that portable thermometer in a used vaccine box, as that will again help with the temperature control, and also with the product information leaflet, so that somebody is not familiar with it, they can actually use that temperature and know how to record and reset the thermometer. Again, most of you are probably using these already. It's just the recommended vaccine monitoring chart. Yes, I keep saying that we do temperature readings twice a day for any of the vaccine refrigerators. and resetting that after we've measured that and documented that, and making sure again that we're keeping this documentation for as long as we keep our medical records. So you can see that it outlines on there the area below 2 where the vaccine can freeze. Then you also have the above the 12, which again with the exposure to heat, and then we've got our middle section, which is where we're wanting our temperatures to sit and maintain that 2 to 8 degrees. This is just about the data logger. So like we said, there are vaccine fridges that have inbuilt data loggers, and there's also, which provides a continuous monitoring of the vaccine fridge. And it's set usually at that to record every 5 minutes, so that we have a really good snapshot of what's happening, and we can, as I said before, identify if there are any deviations from that before an event may occur, particularly if it's to do with a manufacturing issue or a technical issue within the fridge itself. And we can try to avoid any major catastrophe there with a fridge that goes down. It does need to be downloaded weekly, or in the event of a fluctuation in temperature. Again, all of this documentation then would be required if you have a cold chain breach, and you need to send that information off to the public health unit when you're filling in the form. Again, we retain those records as per your medical record policy, and also we can compare the data to assess the accuracy of other data loggers or the thermometers to make sure that they are in working order, or whether we need to get those reviewed and maintenance checked as well. So this is usually the bit that everybody sort of gets a bit nervous about, is when we're actually requiring either to transport vaccines to either an off-site clinic, or whether we need to pack a cooler when we're having a breach or a power outage. So everybody gets a bit concerned. Now, this is all set out in the Striver 5. It's there in black and white. What we've done is actually just done a very brief overview. I've got some nice little pictures there, but the best thing that you can do is actually block out some time and do a mock run of packing a cooler, so that you know in an event of this happening, you're not going to be panicking in that situation, and you know what to do, and you're not going to be second guessing yourself. And it becomes, once you've done it a couple of times, then you know exactly what you need to do. Again, it also helps to reinforce with other team members that are around, particularly if you're not there at the time. They then know and are confident and competent to be able to do that as well. So I would actually recommend that you do this at least twice a year, just to pop it there, and then you can do your competency with your staff and have that that evidence for when you go through accreditation that your staff are trained and know what to do in cases of a cold chain breach. So as we've said here, so we might be doing off-site clinics, or having to, because of a power outage that's a planned power outage, or even an unplanned, having to remove vaccines from our fridge and pop them into short-term storage. So we still need to maintain that cold chain of 2 to 8 degrees, and it must be maintained throughout transportation as well if we're going off-site. So like I said, there are in Striver 5, follow the guidelines on coolers and ice packs. It's there for you. It's set out very clearly. You do need to have a reasonable size, and they recommend at least a 10-litre cooler, or big enough. And you don't want a huge one, because you don't want to be putting all of your stuff in, all of your vaccines in, and then not being able to move it. So if you're doing, you have 2 smaller 10-litre coolers, it will be easier to move around. Also having enough ice packs to be able to cover both of those, or however many coolers you have, making sure you've got enough of the protectant, so either your bubble wrap, or even now they're actually recommending using polystyrene chips because it allows the airflow in the cooler, and so it again prevents that temperature fluctuation. Knowing how to condition ice packs as well to decrease that risk of freezing your vaccines, because freezing of the vaccines will occur usually within that first 2 hours of putting them into the coolers. So making sure that you know how to do that, and I will go through that in a second with you. Again, the bubble wrap, having instructions for how you actually lay out the ice packs and the bubble wrap, that sort of thing, so that other people are aware of how to do that. Like I said, it must be about large enough to be able to fit your vaccines. So whether you need to have two coolers, that's up to your size of your practice and how busy you are with your vaccinations. Again, you need to have a portable thermometer for each cooler, and you'll be recording that temperature every hour. Initially, it needs to be every 15 minutes for that first 2 hours while it's maintaining that 2 to 8 degrees, and then every hour after that while you are outside the clinic or within that power outage time. So this is a quick brief look at how you pack a cooler. So this option can be used, as it says there, for storing vaccines up to 8 hours. And it's important to keep this information where it's accessible for all staff. So if you have your coolers stored in a storage area within your workplace, having this laminated within that cooler or in a folder that they can quickly grab when they need it, that is ideal. So as you can see there, where possible, it recommends, or Strive 5 recommends, that you chill the inside of the cooler prior to placing any ice packs or gel packs in there for a few hours, just to so that it brings that temperature down. And then you remove those ice packs and place in new ice packs that have been conditioned. They recommend using, as I said, the polystyrene chips. It helps to eliminate those hot and cold spots that can occur with the bubble wrap, and because of the airflow, so it promotes that airflow. You need to place the minimum maximum thermometer, that digital thermometer, in the centre of the vaccine stock, so that it's in the coolest part of the cooler. Again, then you surround the vaccines with the packing material, which allows that air to circulate, and then place the conditioned ice packs or gel packs, depending on what you're using, on top, and you close the lid and seal that. Now, you leave that, if it's within that 8 hours that you're requiring for if it's a power outage, then you just leave that as is and just keep checking and monitoring that temperature every 15 minutes for that first 2 hours, and then hourly after that until power is restored. All staff need to, like I said, be aware of this procedure and protocol. Again, having it somewhere easily accessible, and it does not have to be nursing staff. So your admin staff can be, if they are there on a weekend and there's limited nursing staff, whoever, the practice manager, whoever is the person, maybe even in a power outage, that is notified of that power outage, or a back to base alarm from your fridge, they need to be able to know what to do. So again, it's that training and education of all of your staff, and knowing and getting them used to doing this and knowing what to do. So this here comes directly from Strive 5. So as you can see there, they've got ice bricks there at the bottom. Then in this next slide here, they've put they've used bubble wrap, but then they do recommend now that you use the polystyrene chips across the top of conditioned ice packs or gel packs. Then you pack your vaccines in their boxes within the cooler. And then you place in the middle, you place your thermometer, the digital probe there. And on the next slide, then you do another layer of the polystyrene chips, and then the ice bricks or the ice packs or gel packs on the top, and then you seal the lid and keep that thermometer on the top. And I would also have the check the monitoring record sheet for your temperatures on there as well, so it makes sure that people that are walking past can see it and it doesn't get forgotten. This is just a side view, so you can see there how popping you've got your ice packs or your gel packs at the top and bottom, and then you've got your the wraps or the polystyrene chips there doing that insulation, so that it's again protecting the vaccines from getting too cold, but again allowing that airflow around so that it keeps the temperature nice and stable. So just a little bit about conditioning of your ice packs or gel packs. So I'll do ice packs first. So you really need to remove your ice packs from the freezer before you even put them in the cooler. You need to lay them out flat in a single row where possible, and spread out a little bit so that there's airflow around them, and then leave that to the air to expose. And this also helps to reduce this conditioning time. Ice packs can take up to an hour to start to sweat, and that's the conditioning happening. And that usually takes up to, usually sits around that 20 degree mark. So once the ice packs have conditioned, they start to sound sloshy, and they're ready to actually be used in the cooler to cool your vaccines. Gel packs are a little bit different, and you need to look at the types of gel packs that you're using. So making sure, because some of them have got chemicals in that can stop them from breaking down, so reducing that temperature. So you need to make sure that it doesn't. And again, refer back to the Strifer 5 for a bit more information on the use of gel packs. But generally speaking, a gel pack that weighs less than 750 grams, if it's in room temperature, so over 15 degrees Celsius, that usually takes about 45 minutes for that to condition. If it is colder, so below 15 degrees, it will take about an hour before they start to condition. And that's for ones that are smaller. For your over 750 gram gel packs, it will, again, usually take about an hour for the gel pack to condition if it's over 15 degrees in the ambient temperature. If it's under 15 degrees, you're looking at another half an hour, so 1.5 hours before you can actually use the gel packs. So again, making sure that if before you get doing anything, that nobody's actually accessing the fridge, let them know that particularly if you're doing it at offsite clinic, don't access the fridge because we will be taking vaccines out and we need them to be as stable as possible. It's going to take an hour before you can access that fridge. So making sure that people are aware of that. So we've already looked at what a cold chain breach is there. So we're just revisiting that and just reinforcing that it's when vaccines are exposed to a temperature that's outside that 2 to 8 degrees range, or if the temperature is up to 12 degrees Celsius for longer than 15 minutes. Anything below 15 minutes is still acceptable. And if there is exposure to light, so whether they've been removed from their packet, or the glass fridge doors, as that allows the light to penetrate. So if they've been exposed to that light, so please don't remove them from their packaging. If there is a cold chain breach and you do store privately private vaccines, contact the manufacturer of those vaccines to find out whether they are still stable for a shorter lifespan, and then you can change the expiry date on that. But make sure that you have a cold chain breach policy in place so that everybody can follow that. If anything to take away today, to make sure that your vaccine management policy is up to date and reflects the Strive for 5. So reporting a cold chain breach. I'm sure many of you have had the pleasure of doing that, and it is arduous. So we don't like to do it very often, but there is some really good resources that are available to you now as well through Vic Health. So you've got access to the cold chain breach report that you can download, and also access to the form that you can actually download as well and be able to do that. But the first thing we need to do if we have identified a cold chain breach is to put a sign on our fridge like it was before, in red, as big as you want. However you want to say it: do not use, do not discard any vaccines. Cold chain breach, something to that effect, so that people know not to open the fridge and to use any of the vaccines until you are contacted by public health as to what you need to be doing. Download and complete the cold chain breach form, and again, that link that you see there will be in your resources package that you will get at the end of today's presentation. You also need to review your data logger. So download your data logger data, and you need to review that and determine how long the breach has been, when it started, and when it was identified, so that we can then pass that information on to the department, so that they have a better idea as to the vaccine potency and efficiency of those affected vaccines. Once all of that information you've gathered all of that, then work out which vaccines, and you'll be able to do that, which vaccines have been impacted. You'll be able to do that and fill it out on the form as it actually lists all of that there. I'll have a picture of that form in a moment. It's a 4-page document, but I've got the first page there. And once you've done all of that, you email that plus all of the other information that's required. So all of your temperature charts, your data logger information. Usually your vaccine management policy or procedure needs to go as well. Once you've done all that, email that off to that address that you see there on the screen. But again, that's all in the cold chain breach report that you can access, and then start looking at if patients had actually been given any vaccines during this period of time, and highlighting those patients that may need to be contacted about the breach and recalled and vaccinated if required. So having that all of that done, so you'll be able to make it a lot easier if that's necessary. But again, do not discard or use any of those vaccines until the department get in contact with you with regards to those instructions. This here is the first page of that data breach report. So very easy to fill out, and again, you'll get access to this at the end of the presentation, so you can have a look at that if you've not looked at that before. So in the event of a power failure, which is often the major issue with cold chain breaches, we do need to have a contingency plan in place for alternative storage of our vaccines. So whether this is a planned outage or an unplanned outage, so something that's happened while we're there at work, it might be a storm that's caused power lines to go down, etc. We need, in our vaccine and cold chain management policy, we need to have a contingency plan. And this also goes towards accreditation, where you need to have an emergency response plan for these sorts of events. So that means, it could mean talking to your local pharmacy or a pharmacy out of your area, or a sister practice or another medical practice that's not affected by the power failure, asking them whether they could house your vaccines or store your vaccines until you're able to get the power back up and running. So again, it's knowing how to, until that is sorted out, again, putting that do not use the vaccines, power outage, we need to keep the door closed. So however you want to identify that with your team so that they don't access that fridge, that's fine. It can be a big red sticker, or it could be a big just a piece of paper with do not use vaccines, keep door closed. Again, you need to monitor the fridge during this period of time until you get your cooler ready. So again, depending on what you're using, it could take an hour and a half before you're actually prepared to put everything into your cooler. So making sure that you're monitoring the vaccines. Downloading your data logger as well, and the readings there. So you've got that as a baseline for when the power comes back on, if it's possible. If it's a pre-planned outage, then doing that before the power goes out. And ideally, if you can ask your power company, if it's planned, how long do they estimate this to be, the power to be out, so that you have a better idea and can plan a lot easier, as most of the coolers, like we said, have an 8-hour storage capacity and temperature maintaining capacity, unless you're going to be putting it into another vaccine refrigerator. You can also, your glass doors on your fridge, you can cover those with an insulating material. So even one of the space blankets, if you've got those. Place any cold mass in empty spaces so it's not touching the vaccines, again, to maintain that temperature. If the temperature does progress towards the 8 degrees, you need to implement that contingency plan. So hopefully you would have been doing that anyway. You would be getting your cooler together, and sweating off your ice packs or gel packs, getting ready for that. And it also making sure as well that the battery in your digital probe is working. So making sure that you have an extra battery just in case for some reason it's not working. And like I said before, practice. I really do encourage you to do a few mock runs of this throughout the year so that it's not such an overwhelming situation when it does happen or could happen. Oops. So what happens then when the power returns? What do we need to do? We still need to monitor that, our fridge, until it returns to between that 2 to 8 degrees Celsius. So usually we monitor that hourly until it returns to that parameter. We need to reset the temperature on our fridge. So again, people need to know how to do the resetting, so not leaving it up to one person. We need to ensure that our fridge has or is safely sitting between that 2 to 8 degrees. So it may take a little while for it to be stable. If a cold chain breach has occurred, you need to report that and get the process get that rolling. So getting all that data and information together. Like I said, we need to monitor that fridge closely until it's stable. We document the incident, including the cause and the duration and the action that we've taken on our temperature chart at the back, and refer to the Strive for 5. Again, the appendix there, 8 and 9 for the packing and monitoring of your cooler, and again for managing a power failure. These are some of the common issues resulting in a cold chain breach. We've mentioned a few. So overstocking, so not having enough airflow within the refrigerator itself, and the types of fridges and the data loggers that we use. So making sure that we're maintaining the efficacy of our equipment. Particularly with, as it says there, irregular servicing. So making sure that we're doing that at least every year. And again, making sure that our staff know how to use the fridge, how to reset the temperature, how to respond to an alarm, and then what to do after that. Where they document that? Do they put it on the desk on a Post-it note for you? Or do they actually write it on the temperature chart saying at this time, this happened at this, as it says on the back of your temperature chart? Making sure that all staff that access that fridge and are responsive or have interactions with immunisations, that they know to quarantine any of the vaccines that may have been exposed to a breach. Again, looking at how we transport from pharmacy to clinic or to another off-site clinic that we're doing, knowing those procedures. The door being left open can do that. So we often see sometimes the doors don't close. So it may mean that you might need to lift the front of the fridge up a little bit more. So dialing up the stabilizers at the front so that the door will automatically close and it's on an angle. Vaccines being left on a bench. So we don't prepare our vaccines ahead of administering them while the patient's either still sitting in the waiting room and hasn't been seen by the doctor or anything like that. We wait until we've gone through the checklist, we've deemed that they can have their vaccine, and then we get that all prepared so that we're not leaving them exposed and wasting vaccines. Fridge being unplugged. That's a big one too, particularly if you haven't got the signage around your fridges and it's accidentally pulled out. It's in with a lot of other cords, making sure that if there are other power outlets, that you have actually highlighted that this power outlet goes to the vaccine fridge. And it could be a simple mistake that happens, particularly if you're cleaning. The cleaner comes in, they need to pop their power cord in, and if it's not identified as a vaccine fridge power outlet, then how are they to know? So making sure that it's well signed, posted, and hopefully the only power outlet for that fridge. Staff training or inadequate staff training and understanding. So I've mentioned it already, that it's really important that all members of our team are aware of what to do in the instances of receiving deliveries, how they go about. If the fridge monitor alarm goes off, what do they do? Those sorts of things. And also, again, with regards to monitoring of the fridge itself, or even monitoring of the cooler when it's being used as an alternative storage, knowing what to do and how frequently they've got to monitor that temperature. And again, fluctuating internal fridge temperatures. So with the use now of purpose-built vaccine fridges, that's a lot less. But again, if we're overstocking or we're not, or we're we're stocking the fridge so that everything's butted up against a wall, or we're putting things on the bottom shelf, then we've got issues there again with temperature stability. And if you're ever in doubt that there's been you've got any doubt at all, report it as a cold chain breach. Yes, it does take a lot of work, but if it comes back and it's identified with all the documentation that you have that no, you haven't, there's been no issue, then that's a good learning opportunity, so that you have a better understanding of what can trigger a cold chain breach. But so long as you've got your policies and your procedures and you're following those, there's no problem there by putting in a cold chain breach report if you're concerned. One of the things that we need to do as well with regards to our temperature reporting or monitoring requirements relate to before we're removing any vaccines for administration. So we need to check that the temperature on the fridge is within the parameters before we remove any vaccines from that range. Again, it's a double check to ensure that the vaccine has maintained its potency and efficiency. When we all know, even with glass doors, people stand there with the fridge door open and they've got their head in searching, despite all of the things we put in place, even the fridge maps. So again, making sure that our team are aware that they need to check the fridge before they open the door, and make sure that before they remove any vaccine. We have the obligation to monitor the fridge temperature twice a day. Again, manually record the current minimum and maximum temperature of the fridge under strive for 5. Keep that documentation for as long as we would for our medical records policy. We need to download our data logger at least once a week, and annually we need to do a slush test, and that there is a little link on how to do or where you can find out more information about the slush test. Again, it's in strive for 5 as well, but this is something we need to do for our portable thermometers to ensure that they are reading the correct temperature. And particularly once we've changed the batteries, we can do that then, but at least annually as part of our self-audit. And that's to make sure that, again, that they're all reading correctly. Also, we need to make sure that we're having the servicing done annually of our fridge and any other equipment that we're using, and changing of the batteries, making sure that we've got a protocol, a checklist to make sure that that's done, to record that. Keeping all of this information, again, towards accreditation, and I will look at that in just a moment. And then if there's been a potential breach that's been identified with any of the data that you've been looking at, or physically, then we need to notify our public health unit about that. So like I said, the slush test should be conducted if it's a new thermometer, or after changing the battery, or every 12 months, or if you're having any problems with cold chain. So like, you can access that information, and basically it's using a polystyrene cup, filling that, you can see there, with water, popping that in the freezer until it actually forms just a hard layer across the top, then putting the probe of the thermometer in that, not making sure it's not touching the sides, and waiting until the temperature comes up into that between 2 and 8 degrees. And that gives you, that's the slush test to say that the portable thermometer is actually working as it should be. But again, have a look at the resources that you will get access to. We also need to educate our patients as well with regards to cold chain, as it's essential it's about safe handling and storage of their pre-purchased or their purchased vaccines. They need to hand them directly to staff as soon as they arrive, and it needs to be labelled with the patient's name and placed in the vaccine fridge. And they should be stored for the patient and should not be swapped or administered for any other patient. Often this is where an issue will arise with regards to cold chain, and it's because of the delays from the patient receiving the script, going to the pharmacy, purchasing their vaccine, bringing it to their appointment and putting it into maintaining that cold chain to the fridge and then to their arm. Often even though they're given a little bag and directed by their pharmacist that they should put it straight in the fridge, they might have half an hour before they get home because they've got to go and do the school run, so they're picking up their child in a hot car. So the potency and efficacy of that vaccine has been compromised. And we are, as immunisers, we can actually say, well, look, I can't verify the potency of that vaccine. You bought it yesterday, yet it's lukewarm. You can actually feel it, that there's no coldness. The cold chain has been breached. You can say, look, if I give you this, it's not going to be effective because there's been a breach in the cold chain. Ideally, the patient should purchase their vaccine the day of their appointment, bring it straight from pharmacy to to your practice, from the front desk straight into the fridge to minimise, sorry, itchy nose, to minimise any risk of breach in cold chain. So I know Sarah has often mentioned that she has refused to give the vaccine to a patient because she said it's not going to be effective. I'm giving you something that's not going to give you protection. Even though you've paid money for it, it's not going to do the job that you're wanting it to do. So, and then it's up to them as to whether they go ahead and get a new script. But we are within our practicing scope to say, look, I can't verify that this is a safe vaccine for you to have, that it's going to do its job. Again, we've got state and territory requirements with regards to cold chain management policy, and in Victoria you have online learning that you do around cold chain management, and that is available through the immunisation e-learning hub. If you haven't done any of that, basically you can access that through that link on the page there. And there's two modules that you can do. One is the mandatory cold chain management e-learning that at least one of the people in the practice looking after vaccines must have done. And then there's also the clinical vaccine cold chain management e-learning module for those that are the immunisation program officer for immunisation that is required for the practice. And like I said throughout, all of this goes back to our accreditation and requirements through accreditation to maintain vaccine potency. So that, as you can see there are 4 criteria that we in general practice need to be able to demonstrate and have evidence to prove that we are actually meeting these standards. So the first one there is that our practice has at least one member of the team who has primary responsibility for cold chain management in the practice, and that's where that nurse's name goes in the policy for cold chain management or vaccine management policy. Also making sure that it's written within your position description if that's your role, and have the evidence. So having that person's evidence and making sure the team know who has overall responsibility for that, so they can ask any questions that might occur and go to for advice if there's an issue. The team member who has primary responsibility for cold chain management ensures that the processes used complies with the current edition of the National Vaccine Storage Guidelines, STRIFA 5. So again, making sure that your policies and procedures are in line with STRIFA 5 and having that there as evidence in your policy to show the surveyors when they come around and do their on-site visit. Then you have the team member who has primary responsibility for cold chain management reviews the following processes to ensure potency of our vaccine stock. And that includes ordering and stock rotation protocols, maintenance of equipment, annual audits of vaccine storage procedures, continuity of cold chain, including handover processes between designated members of the practice team, and accuracy of our digital vaccine refrigerator thermometer. So again, that's making sure that everything is working and you've got plans to have equipment reviewed and calibrated, that the protocols are up to date. You've got proof of your ordering and stock and how you go about stock rotation. So having that in the policy, making sure that all staff are aware. So whether that's they sign that when they're onboarding as part of their induction process. Doing the annual auditing of the vaccine storage procedures, so making sure you're doing the slush test annually. Competency of your staff with regards to emergencies or with potential breaches, so how they respond to the alarms on the fridges, the documentation, packing of the coolers, those sorts of things. And again, keeping the documentation of your monitoring of your thermometers, your temperature charts and things like that, and having those available for the surveyors on the day. And the final part there is our practice has written practice-specific policy that outlines our cold chain processes. So making sure that it reflects your particular organisation, and rather than having a generic, how it works for you, because you might, one practice down the road may only have one nurse, so therefore that's his or her whole responsibility, whereas you might be working in a larger organisation where you have multiple staff and there are different staff members responsible for different parts. So making sure that policy and procedure reflects how you do those sorts of things within your organisation. Finally, some tips and tricks. So as mentioned before, if in doubt, quarantine. So if you've got any worries at all about whether there has been a breach, quarantine the vaccines, make sure people don't use them by putting a sign up to say don't use, possible cold chain breach, and then contacting your public health unit and doing the documentation and following through that way. Ensure that your fridge door is always closed. So like I said, sometimes fridges don't always close and catch properly. So it may mean elevating those stabilizers at the front so that the fridge is on a bit of an angle so it will close straight away. Remove vaccines only when you're ready to use them, not taking them out 10 minutes beforehand and getting them all ready before you actually assess that the patient is able to have the vaccines. Checking the temperature of the fridge every time before you open that door. Rotating your stock and checking those expiry dates. Ensuring that a valid vaccine order is placed prior to removing vaccine. That means that you've put your order in. If you've had a cold chain breach, making sure that that your vaccine order has gone in before you discard any of the shorter date vaccines. And if you go into the appendix in STRIFA 5, there's a really good resource there with all frequently asked questions that people have asked over many, many years, and some good answers to be able to answer some of those there. So have a read of those as well. And that basically comes to the end of our evening with 5 minutes to spare. My goodness. All these resources will be made available for you in the
Email
resource
form.
package. Yes.
Yes.
So that'll be good. And the final thing there is that if you have downloaded the Florence app, you can actually capture this as CPD tonight if you scan this QR code. So I'll leave that there and you can do that. Otherwise, I'm open for questions.
Perfect. Thank you so much, Deb. It's just always amazes me how much content is actually required to get a
It
really good
is.
understanding of cold chain. Trying to do it in an hour and a half with, good justice is always really difficult. So thank you so much. We have had quite a few questions come through, which is wonderful. Some of which I think you have actually answered through the presentation. So I've made some slides to answer some questions. So I'll start without the slideless ones, and that every way everyone can do their Florence recording while that happens. So I thought a really good one. Which day of the week is the best day for uploading the data logger? Well, in my practice, it's a Monday. What about your practice, Deb?
I think yes. I think I did everything on a yes. I do usually do things on a Monday. I haven't had the I haven't had the role there doing that for a while. So, but I used to do it on a Monday because it was just simple after a weekend, having it
Absolutely.
been closed, and then you can actually check to see if there's any issues that may have occurred.
I think the biggest thing is it a day, when you're at work? That's always a good start, particularly if you work
Yep.
part-time. If it's a day that you will remember, and it fits in with your workflow. So I think it will differ from practice to practice. And it's part of having that as the policy and procedure in your practice. You can designate which day that the data logger is downloaded.
Yep.
The backup plan when a fridge fails, I hope we've thoroughly covered that this evening. If not, please email us and ask questions and we can go through that in more detail with you. And I think this is a big one that we get a lot. So the inability to get polystyrene cups anymore. I'm not sure what it's like up in Queensland, but it's certainly, we're very environmental down here in Victoria.
Yes.
So
yes.
I shudder to say I've had to go to Amazon to order mine, which I don't
So
love
if you can get so if you can get a bit of a stock and that's all they're used for. You're only using one a year, so hopefully. And squirrel it away.
Yes.
That's probably the best thing to do. Yeah.
Absolutely. Very, very, I was going to say not used for anything else other than slush testing of your refrigerator.
Yes.
All right, wonderful. So I might share some slides.
Yeah.
I was going to say, I can never remember the coordination. That's always my challenge with these things, is which one do I go first? All right. So, and this is just to answer some of the other questions that have come through. So around the education modules for Victoria. So let me, oh my goodness, and now I can't even see the bit on my screen. Here we go. So if you weren't aware, the Vic government immunisation modules that we discussed, so this is where you find them. So there's two. Now, there was a question around whether it needs to be done annually. I think it's like anything with CPD. It's always good to do a bit of a refresher of those key responsibilities. So whether you come to a webinar like this and we do an update this way, if you find that you're more of a online learning kind of person going along and doing this every year, that's absolutely fine. The requirements around having a one-link vaccination account are that at least two people have done the training. So you have your main vaccine coordinator, and again, that doesn't have to be a clinician, but it usually is, and that there's also a backup person as well. So the requirement for the vaccine coordinator and the backup person is to do the clinical staff vaccine coordinator module. The other non-clinical staff module is there for education. My rule of thumb is if someone in your practice touches a vaccine from the moment it walks through the door till it ends up in an arm or a thigh, getting them to do the module is a really good way to really make sure your cold chain processes are robust in your practice. Now, here's a fun question for you, Deborah. We've had a few questions about baskets. So the current Strive for 5 guidelines, which is the 3rd edition, and yes, there are some new ones coming. So they're expected to be released in October, is the latest update that we've had, which is the first update in, I think, between 5-6 years, I think.
Wow,
so
it's been a while,
very
yes.
exciting. But we're going with the 3rd edition because that's the ones that are current. So The guidelines are that vaccines must be stored in their original packaging, which you covered, because they don't like UV light. They don't like changes in temperature. They love a bit of airflow. It's like me in hot weather. I love some airflow around. So when we talk about a basket for storing vaccines, Deb, you want to walk through, particularly my really good example on the right-hand side, which is actually, and I'm not going to say which government from, but has 3 really good containers and 1 not good one in there. So if you want to go through that, Deb.
I mean, the biggest thing is airflow. So we want something that, as you can see there, that will actually let air through. You don't want an occlusive container, as you can see there on the top corner in the 3rd picture, as that restricts the airflow. But again, it interrupts with the temperature management as well. So any basket that has holes in it, as you can see there, slots in it, will be perfect.
Wonderful. So I hope that answers the question for those of you who are really interested in baskets. Now, just out of interest, I will show you. So this is the sign that I have in my practice that goes on the fridge in case of cold chain breach. So it lives next to my temperature chart. I have a little cold chain breach pack, and this is right on the top. So I can lock my fridge and have no one touch it. Also, Steve Carell. There's worse things to look at. So that brings us to the end of the evening. I'm going to flip across here. So thank you all so very much for coming. We love feedback. We love, that was great. You didn't answer this. I'd love to know more about, can you do a session on? So please, QR code. Also, when you get your link, which will include a recording and all the resources that we've discussed this evening, that will be emailed within a week of the presentation. If you've had anything that you've thought about later, you're more than welcome to reply to that email and we'll answer your question. All right, wonderful. But with that, thank you very much, Deborah, for your time. Thank you, everyone, for attending. And I look forward to fabulously stored vaccines across our region moving forward. Have a good evening.
Bye, everyone.